Cardiovascular disease is a global health issue, and more than 17 million people will die all across the globe every year due to a cardiovascular cause. And out of these, 25% of them will die suddenly. And in United States alone, more than 1,000 individuals will drop dead suddenly every 24 hours. Yes, every 24 hours, more than 1,000 individuals will drop dead suddenly. Sudden cardiac death can knock anyone hard, but often it does not knock before it can enter through your door. Sudden cardiac death does not differentiate between an experienced politician or a rich or famous athlete. My talk is going to be based on who, how, why, and what. And in the next 15 minutes or so, I'm going to discuss as to who is at risk of sudden cardiac death, how sudden cardiac death happens, why it happens, and finally, I'll finish with what we can do to prevent sudden cardiac death. As you can see here on the pie chart, the sudden cardiac arrest accounts for more than 50% of all causes of deaths that have been mentioned here. There are few epidemiological studies that have come up from some countries. And as you can see here on this bar diagram, the incidence of sudden cardiac death have been reported from some of the countries mentioned here. Now, it may become quite evident from this bar diagram that the incidence is higher in some of the countries like North America, Canada, New Zealand, Australia, and some European countries. But the fact is that the incidence that you see from the developing countries, some of them that have been mentioned here, they may not be very accurate. And the reason being that there is probably inadequate data collection, and in addition, there may also be some fallacy as to how they report incidence of sudden cardiac death from these countries. The occurrence of sudden cardiac arrest in men is double as compared to women. And as you can see here in the bar diagram, as we grow older, our risk of dying suddenly also increases. Now, this is primarily because of as we grow older, our risk, incidence, or prevalence of cardiovascular disease also increases. And cardiovascular disease is, in fact, the most important underlying cause or etiology for sudden cardiac death. It has also been shown that the colored men and women have got higher risk of dying suddenly compared to their white counterparts. Now you may ask why this is. Now we do not know the exact reason, but some of the theories that have been put forward, one is they may be genetically different from each other. Number two, the access to medical facilities and how much facilities they can avail is limited in the non-whites. Thirdly, it has also been shown that the non-whites, they have got higher incidence or prevalence of the traditional risk factors like diabetes, hypertension, obesity, smoking, and so on. And lastly, the non-whites, they have a tendency to seek medical attention late, or they do not seek any medical attention in case of emergency if they are having, for example, chest pain or any acute cardiac issue. Cardiac arrests can happen outside the hospital or inside the hospital. And it is also known that less than 10% of the victims who suffer a cardiac arrest outside the hospital setting will actually survive. It has been shown that survival following cardiac arrest that happens outside the hospital, particularly in men, is much lower compared to cardiac arrest that happens inside the hospital for men. Now, the reasons are primarily two. Number one, when cardiac arrests happen outside the hospital, there is less of skill, experience, and also resources that are available to prevent a death that has happened following a cardiac arrest. Now, this also includes the availability of the automated external defibrillators. The second is there's a delay in providing early resuscitation by a bystander when the cardiac arrest happens outside the hospital. Women have lower chances than men to be resuscitated and survive out of hospital cardiac arrest. Now, this has once again been published in the European Heart Journal only recently, and this concludes that when outside cardiac arrests happen for women, their survival is lower compared to men. And this is once again because they often do not receive the initial resuscitative measures by a bystander. And secondly, these women are also found to be in a non-shockable initial rhythm. So obviously their chances of survival following a cardiac arrest is less compared to men. Now these two pie charts show the underlying cause or etiology for sudden cardiac death or sudden cardiac arrest. Now if I can draw your attention to the pie chart on the right hand side, and these are for the older patients who are above the age of 35, majority of these individuals will have sudden cardiac arrest or sudden cardiac death due to underlying coronary artery disease. And when you look at the younger individuals who are less than 35 years of age, majority of these individuals have underlying cause for sudden cardiac arrest or sudden cardiac death is hypertrophic cardiomyopathy or idiopathic left ventricular hypertrophy. We read in the newspapers, we see it on the television, an athlete running a 100-meter track race suddenly collapses on the finishing line, and in few minutes he is declared dead. A footballer who kicks the winning goal collapses on the ground, is found to be in cardiac arrest. Resuscitation measures take place, but unfortunately it is not successful, and once again he is declared dead. Now, contrary to what we read and what we see on the television, majority of the cardiac arrests actually take place during sleep. Yes, majority of the cardiac arrests actually take place during sleep, and then it is followed by at rest, then during light activities. So the fact of the matter is that the cardiac arrests are less commonly seen when people are actually exercising or after exercise. Arrhythmia, we all know, and that too, ventricular arrhythmia are the commonest underlying mode that causes cardiac arrest. And out of these, ventricular fibrillation tops the list. And then this is followed by polymorphic ventricular tachycardia, and then by torsade point. Now, torsade point is a type of polymorphic ventricular tachycardia where the QRS complexes are different from each other. The axis point, they also change across the baseline. But in these patients, you have got to demonstrate an underlying prolonged corrected QT interval. Yes, prolonged corrected QT interval has to be demonstrated before you can say that this is torsade point. Now, the real question is this sudden cardiac death really sudden? Now, the German researchers have shown that the sudden cardiac death may not be sudden, and they have described sudden cardiac death as real lightning, which is usually preceded by clouds, wind, and rain. So what does that mean? So that means that sudden cardiac arrest may be preceded by some kind of symptoms. And according to their study, it has been found that 75% of the individuals who actually survived the sudden cardiac arrest had some kind of symptoms few minutes before they actually had a sudden cardiac arrest. And these symptoms more commonly were chest pain, followed by shortness of breath, palpitation, dizziness, and syncopal symptoms. A similar study that has been published again quite recently in the Annals of Internal Medicine. Now, this is a community-based study in Portland in Oregon in USA, and this study has been done on more than 1,000 patients from 16 hospitals over a 10 years period between 2002 and 2012. And this has once again shown that the cardiac arrests or sudden cardiac death are actually not sudden. And again, 75% of the survivors of the sudden cardiac arrest had some kind of symptoms 24 hours preceding the cardiac arrest, and 90% of them had some kind of symptom preceding a week of sudden cardiac arrest. So sudden cardiac death actually may not be sudden. So it gives you warning maybe minutes, hours, even days before it is going to happen. And it has also been shown that the mortality is obviously higher, first, who do not acknowledge their symptoms, that they have symptoms, and secondly, who do not seek early medical help. So this is a vital piece of information from these researches, and it is again a vital warning or a lesson for everybody that if somebody has a symptom, early medical attention should be sought before a catastrophic event takes place. The risk of sudden cardiac death following myocardial infarction or following coronary artery bypass surgery is maximum in the first 30 days. Now, this risk gradually decreases in 3 months and then in 6 months. Now, here is quite a long list of selected risk factors for sudden cardiac death. Now, it's not my intention for you guys to read through this slide, but what I want to highlight is that ECG forms an important tool to assess the risk of sudden cardiac death, and we must look at those clues on the ECG that may help us to risk stratify an individual for sudden cardiac death. Now, some of the ECG parameters that I have mentioned here that must be kept in mind when we are risk stratifying an individual for sudden cardiac death. But we must also not forget the signs, ECG signs for channelopathy such as Brugada syndrome, arrhythmogenic right ventricular dysplasia, and also the long QT interval syndrome. Now, due to time constraint, I cannot go through all the ECGs and all the ECG parameters or markers that may predict sudden cardiac death. But just to show a few ECGs that we must keep in mind, and these are some of the subtle signs on ECGs that you may come across. Now, here you see a 12-lead ECG, and if I can draw your attention to lead AVR. Now, lead AVR, most of us, we consider this lead as an inert lead. We don't even pay attention to this lead when we are reporting 12-lead ECG. But AVR in setting of acute coronary syndrome is important. And if there is ST elevation of more than 1 millimeter in AVR, while there is ST depression in rest of the leads, then it is highly suggestive of severe left main coronary artery disease, and also it carries with it a very poor outcome. Similarly, deeply inverted or biphasic T waves, in particular in leads V1, V2, and V3, is highly specific to critical proximal stenosis of the left anterior descending artery. Now, in both these scenarios, the patients are at risk of massive anterior wall myocardial infarction. Yes, the patients are at risk of massive anterior wall myocardial infarction, and that may complicate with ventricular fibrillation or malignant ventricular arrhythmia that may actually predispose a patient for sudden cardiac arrest or sudden cardiac death. Now, early repolarization. Now, you must have come across this kind of ECG in young and healthy individuals, and we may report as these ECGs are normal or they just show early repolarization changes, and therefore nothing else needs to be done. Now, some retrospective studies have shown that early repolarization changes, in particular in inferior and lateral leads, or you can say inferior lateral leads, predisposes that person for malignant arrhythmia and can be a cause for sudden cardiac arrest or sudden cardiac death. Now, time again does not permit me as to show you the individual ECGs with different types of early repolarization changes, but just I can highlight here that there are four types of early repolarization changes that have been identified, and it is just one of those four types that actually puts someone at risk of ventricular arrhythmia, sudden cardiac arrest, or sudden cardiac death. Now, this study has looked at the different ECG parameters that can predict anybody's risk for sudden cardiac arrest or sudden cardiac death. And taken into consideration all these parameters, they have devised an electrocardiographic risk score for predicting sudden cardiac death in general population. And what they have shown is that greater the number of abnormal ECG parameters, higher is the incidence of sudden cardiac death in these individuals. So pick up those ECG parameters which can predict sudden cardiac arrest, put them together and see how many abnormal ECG parameters are there, and individually you can work out the risk of or the incidence of sudden cardiac arrest in these individuals. Cardiovascular imaging provides us a lot of information in predicting sudden cardiac death. Echocardiogram, as you all know, is the oldest friend of ours that help us immensely in identifying structural changes in the heart, and most importantly, the left ventricular hypertrophy and left ventricular enlargement, the poor left ventricular function, and so on. CT scan helps us to identify the anomalous coronary arteries, dilated aorta. It also helps us to identify the calcium deposits or atheroma in the coronary arteries that put risk of an individual for any sudden cardiac arrest or sudden cardiac death. Cardiac MRI helps us to identify the areas of scarring on the myocardium that may actually be a substrate for ventricular arrhythmia and sudden cardiac arrest. Now, how about lab parameters? Rise in troponin, BNP or NT-proBNP can predict sudden cardiac arrest or sudden cardiac death. And higher the levels of troponin, BNP, NT-proBNP, higher is the risk of sudden cardiac arrest. Now, we must not forget about the electrolyte imbalance. Severe hypokalemia and severe hypomagnesemia, they both put somebody at risk of prolongation of QT interval that can predispose anybody for polymorphic ventricular tachycardia or torsade point. On the other hand, hyperkalemia or severe hyperkalemia puts anybody at risk of advanced AV block or complete heart block that can also lead to sudden cardiac arrest. So when we put everything together, the clinical factors, the ECG parameters, the echocardiographic or cardiovascular imaging parameters, and occasionally looking at the genetic testing results. Now putting everything together, we can assess anybody's risk of sudden cardiac death. So with that in mind, there are few risk calculators that have been developed for the last few years. And one of the risk calculators you see here takes into account the clinical features and the ECG parameters. And as you can see here, you can work out 10-year risk for sudden cardiac death for these individuals. Similarly, European Society of Cardiology has also devised a risk calculator for sudden cardiac death for hypertrophic cardiomyopathy patients. Now, as you can see here, there are a few parameters that you can punch in, and then you can assess anybody's risk for sudden cardiac death for 5 years. And then the European Society of Cardiology also gives you recommendation as to what should be the next line of management for these kind of patients. Similarly, here's a risk to assess the sudden cardiac arrest using this calculator for patients who have undergone PCI, percutaneous intervention. Now, this is a tool or a calculator that you can download on an iPad or iPhone. Unfortunately, this is not available on any Android device. So what it consists of is a questionnaire of 10 questions. And as you answer the 10 questions, you will come to the final step, as you can see on the right panel, that gives you the risk category for that individual. And here, the risk category is high based on the information that you have provided. So this is again a useful risk calculator for the patients who had an incident of coronary event and they have undergone PCI. Now, prevention of sudden cardiac death. I think this is the most important slide. We know all about the sudden cardiac arrest, how it happens, why it happens, what are the underlying causes, but we must put all emphasis in preventing sudden cardiac arrest or sudden cardiac death. Now, as I have already mentioned that majority of the causes or the underlying cause for sudden cardiac arrest or sudden cardiac death is cardiovascular disease. Now we must put all emphasis in preventing, and that includes the primary as well as secondary prevention of cardiovascular disease for that matter. We must also put emphasis on screening for structural heart diseases and also screening for abnormal electrical substrate. And it goes without saying that radiofrequency ablation and device implantation, in particularly implantable cardiac defibrillator, should be of paramount importance when it comes to prevention of sudden cardiac death. Now, cardiac screening is the first and the most important step in prevention of sudden cardiac arrest. And cardiac screening starts with a brief consultation with a cardiologist or a physician, where it is important to assess, first of all, the symptoms of the patients and also take family history of sudden cardiac death. And we would also like to tease out if there could be any underlying cause for sudden cardiac death in the family that have already occurred. This is followed by a 12-lead ECG and then by an echocardiogram to look at the structure of the heart. And sometimes we also need to stress the patient using a treadmill stress ECG or any other way we can stress the patient to bring out those changes that may suggest underlying coronary artery disease. Rarely we do CT scan to look at the calcification on the coronary arteries and also an ultrasound of the carotids to look at those intimal thickening of the underlying coronary arteries, of the carotid arteries. We will be failing in our attempt to prevent sudden cardiac death if we do not focus on education and increasing awareness amongst the healthcare professionals as well as the general public. Now, it is important, first of all, to recognize that a sudden cardiac arrest has happened and then to react and respond to ask for medical help as soon as possible. Emphasis should be made on training on basic as well as advanced cardiac life support and also training on the use of defibrillator that includes automated external defibrillators. So ladies and gentlemen, I would leave you with these thoughts that sudden cardiac death has indeed got a high prevalence. It is a global problem, and sudden cardiac arrest or sudden cardiac death is happening every hour, it's happening every minute, it is happening every second. So we therefore must work on risk stratifying individuals as to how we can appropriately risk stratify them and how we can manage them further. We must learn and we must educate and also increase awareness as to how we must react and respond promptly when an actual sudden cardiac arrest has happened. And it goes without saying that this is only possible with continuous education, training, and increasing awareness. And with that, I thank you for your patient attention.